Hi, my name is Kelsey and I'm going to demonstrate for you some of the different parts of the heart using this sheet part that I have. So there is the visceral pericardium, which is the outside layer of the heart, and the apex is down here and the base is up here. Then we have the right and left atrium. The right is here and the left is here. They're the top two chambers of the heart. The blood in the right atrium is deoxygenated and the blood in the left atrium is oxygenated. Then we have the right and the left auricles. They're up here and they are muscular pouches that come off of the atriums, and they receive blood and hold blood, and they also help to move blood into the ventricles. Then we have the right ventricle and the left ventricle. They're the lower two chambers of the heart. And we have the interventricular sulcus, which is this groove here, and in it is the posterior interventricular artery and the middle cardiac vein. And then the pulmonary trunk, it originates in the right ventricle over here, and it leads to the right and left pulmonary arteries that come up here. So the blood that's in this vessel is going to the lungs, and the blood is deoxygenated. Then we have the aorta, which has been cut off from my sheet part, but it is right here, and it originates in the left ventricle. And the blood in this vessel is going to the circulatory system all throughout the body. The blood is oxygenated. There's the ascending aorta, and it's the part that's going up first, and then there's a loop, and that's called the aortic arch. The first little passage off of the aorta on the right side is called the brachiocephalic artery, and then the middle one is called the left common carotid, and then the one farthest left is the left subclavian. So then behind that we have the superior vena cava, which I can show you by putting this in here. So the superior vena cava is leading into the right atrium, and then underneath that, under here, would be the inferior vena cava. Then between right here, if we looked right between here, we would find the coronary sinus, and the blood in the coronary sinus vessel is going to the right atrium, and that's all three of those, the superior vena cava, the inferior vena cava, and the coronary sinus are all going to the right atrium, and they're veins, and the blood that is being carried by them is all deoxygenated. So I just cut the heart open. So if we look inside of the right atrium, we can see the pectinates, or the stringy looking muscles at the top. They're right around here. And we can see the myocardium, which is the lining, the wall muscle of the heart. You can see it on both sides. And you notice that on this left side, it's a lot thicker. The left side myocardium of the ventricle is a lot thicker because the left ventricle has to pump blood to the entire body, whereas the right side only has to pump blood to the lungs. So, if we look inside of the ventricles, we can see the trabecular carne, which are the muscle, if you look down here, the muscles at the bottom of it. And if we check out in between the two sides of the heart, if you look in the middle, you can see there's a dividing wall, and that is called the interventricular septum. Then in the on the left side of the heart, we find the the bicuspid valve, which is right here. And on the right side, we see the tricuspid valve right here. So then when we look, let's check back on the left side. So the chordinae tendineae holds the valve here. They are the stringy things holding the valve to the heart. And the cusps of the valve are the big white parts of the valve themselves. And the papillary muscles are the muscles behind that holding the valve to the heart inside. Then we have the pulmonary semilunar valve, which that, if we look in the right side of the heart, we see this coming through. Up here, between the opening of the heart and the opening of the pulmonary trunk, it's the valves between there. And then if we look on the opening on the left side of the heart, between the aorta and the heart, the opening of it, there is the aortic semilunar valve.